Hello friends, today we are going to discuss or revise about depression, which is one of the most common cause of suicide, and it is also one of the most common psychiatric disorder which we read or see almost every day in our life. Before I discuss about the symptoms, etiology and treatment plan, remember that I'm recording this video so that if this question comes in our mind, comes in our exams or in a viva, we can highlight the important symptoms and the etiology and treatment plan and get good scores. Please do not go on diagnosing your relatives, your friends, or people in your neighborhood after seeing this video. Diagnosis of any psychiatric disorder or for any disease or disorder should be done by a qualified licensed healthcare professional, healthcare worker. So this is just for revising the diseases, or I could say that this is just for academic purpose. So let's start. Depression, as I have written here, it's the most common cause of suicide, and it is the most common it's the most common psychiatric disorder in India. Now, some books says that the symptoms of depression should be present in a patient for more than 2 weeks. Some says for at least 2 weeks. So to be on safer side, I've written 2 weeks, more than 2 weeks. Okay, you have to remember in mind the word 2 weeks. Okay, so this is a very common mnemonic to remember the symptoms of depression, SIGECAPS. So we are going to see what each alphabet means in this mnemonic. Okay, S over here stands for sleep. So a person having depression will not have a good sleep. That is, the patient or the client will suffer from insomnia, and there are two very characteristic sleep disturbances seen in a depression patient, and that is early morning awakening and reduced latency of REM sleep. Now, what do you mean by early morning awakening? So many people get up early morning, right? This means, like for say example, I usually get up at 7 a.m. in the morning. Okay? But now, since I'm suffering from depression, I will get up like around 5 a.m., 4:30 a.m., 4:45 a.m. So this is called early morning awakening. I'm getting up earlier than the usual time of my day. And reduced latency of REM sleep. If you have seen my previous videos of stages of sleep, I have discussed in brief about the REM and the non-REM sleep. So for a patient who's suffering from depression, they have reduced latency of REM sleep. You have to remember these two characteristics: early morning awakening and reduced latency of REM sleep. Okay, now the second alphabet, that is I, over here represents interest. So a patient of depression will have no interest in any activities, which they used to do it very nicely or with a lot of interest earlier, but now because of depression they have no interest in their activities. There is a term called as anhedonia, which means loss of interest in the activities or loss of pleasure in doing or in doing activities. The term is anhedonia. Please remember this term. The G over here stands for guilt. A depressive patient have a lot of guilt feelings, excessive guilt feelings, and they just blame themselves for small issues, for trivial matters. E over here stands for energy. The patient have less energy, or you can say low energy, or you can say decreased energy level, and they are easy, they are fatigue all the time. They are easy fatigable, and are easy fatigable. Okay. C over here stands for cognition, or you can say concentration. Now, always remember, when we say cognition, we mean thought. Okay, the thought, THOUGHT. So a patient may have negative cognition, that is negative thoughts, and they may have poor concentration, not able to concentrate in any one work at a time, not able to study at one at a time. Lack of concentration is seen or has been documented in people suffering from depression. A over here stands for appetite. The usually a depressive person or a patient, they have less appetite or low appetite. They eat less, and that's the reason they don't gain weight. There is loss of weight reported in a depressive patient. Now, the P over here stands for psychomotor agitation, or you can say psychomotor retardation. This means that the patient, you can see a lot of increased in the psychomotor activities, like the patient is very restless, or you can see decreased, which means the patient is always lying on the bed, not doing anything, does not get up from the bed, just lying on the bed, not sleeping properly. So this is psychomotor retardation or psychomotor agitation. The last S over here stands for suicidal thoughts. They have a lot of suicidal thoughts. Sadness of mood is there. So you have to remember all these symptoms by this mnemonic. Also, among all these symptoms which we have discussed now, if you see in a patient, if you happen to see that this patient is having suicidal thoughts or suicidal ideas, this patient is having weight loss, not eating properly, this patient is having anhedonia, that is loss of interest or loss of pleasure in doing activities, as well as guilt feelings. Okay, so these four symptoms are very quite suggestive of depression. Okay, you have to quickly uh, come to a diagnosis and plan further treatment management. Now, there are two very characteristic physical signs which you will see in a patient having depression if you happen to do internship in psychiatry ward or work in a psychiatry department. There are auto very good fold or omega sign. Now, what is auto very good fold? Some people also call it as just very good fold. It is a triangular shape fold in the nasal corner of upper eyelid, and this sign or this fold is seen in a patient suffering from depression. Okay, the second sign is an omega sign. Omega, I hope I think we all remember, right? In physics we used to have a lot of Greek letters. So it's like this omega. I've made a small image over here. Omega sign, or some people also say as inverted omega sign. This is again an omega shaped fold, almost looks like this, in forehead above root nose, like you know the place where girls put bindis, right, in between the two eyebrows. So over there, that place, you will see a sign like this, and this sign is seen in patients having or suffering from depression. Okay, so sometimes spot diagnosis comes and they just give a picture with this sign or this auto very good fold, and they asked for just the diagnosis. So you have to see the sign, appreciate them, and then give the answer. You can also Google and actually appreciate the pictures of patients with these two physical signs. Now, we have discussed about the very common symptoms of depression by the mnemonics. Sometimes some patients also have some special features, and I have characterized them into psychotic features, atypical, melancholic, and catatonic features. Okay, let's start with psychotic features. Well, in this psychotic feature, a patient of depression will also show delusions and hallucination. And remember that psychotic features are usually seen in severe depression. and that's the reason sometimes it is also called as psychotic depression. Atypical features. Okay, so a few minutes ago we just discussed in this mnemonic that the patient does not sleep, insomnia is there, does not eat anything, there is loss of weight, loss of appetite. But some of the patients have atypical features, which means they sleep a lot, hypersomnia, they eat a lot, overeating. So a lot of weight gain is there and the appetite is increased. So in some of the patients, atypical features are also seen. Melancholic features. This means or this indicates severe anhedonia. Anhedonia, remember guys, lack of interest or lack of pleasure. So in melancholic features, severe anhedonia, profound guilt feelings, and early morning awakening, weight loss, agitation, and this melancholic patients which actually exhibit these features, these melancholic features, they are, it is usually seen in old age, and they are of high suicide risk. Melancholic features are usually seen in old people suffering from depression. Okay, just remember this. Catatonic features, in this the patient has negativism, and the patient is show symptoms of stupor. You have to just remember this. Okay, now let's see the etiology of this disorder. Okay, so there are biological factors which says that depression could be due to decreased levels of serotonin, norepinephrine, and dopamine. Also, there are some researches which have documented about hormonal disturbances, which says that hypothyroidism is a common cause of depression. I repeat, hypothyroidism. Also, due to elevated HPA activity, that is elevated hypothalamic pituitary adrenal axis activity, depression could be there. So this has also been documented. Also, there is this decreased activity in dorsolateral prefrontal cortex and increased activity in amygdala, which has been seen in patients suffering from depression. So these all hormonal disturbances have been documented. Now, there is also psychological theories, which includes cognitive theory, which was proposed by Aaron Beck. Okay, and it's actually called Beck's cognitive triad, in which he says that negative thoughts in depression sustains depression itself. And the Beck's, that is BECK, Beck's cognitive triad says that there is negative view of self, as in the patient has a negative view of himself, patient has a negative view of environment, and the patient has negative view of future. So these three negative views, negative view of self, negative view of environment, and negative view of future, this is called the Beck's cognitive triad. Now, some of the gene mapping studies have also found linkage, and that has also been documented that some of the gene factors are also responsible for depression. There's also one theory called as learned helpness theory, which says that patient, due to repeated or recurrent adverse event in a patient's life, the patient has no control over those events. The patient has experienced so much of loss because of those adverse events, that the patient starts believing that nothing good is going to happen. The patient loses the motivation to act, to do anything, and this results in depression. These are the the possible etiology or causes which has been documented, which I have just spoken about. Now let's see about the treatment or management plan for a person suffering from depression. Okay, so we have pharmacotherapy, that is use of drugs. We have antidepressants, which include TCAs, SSRIs, SNRIs, MAO inhibitors and atypical antidepressants. Remember that all the available antidepressants, they take around 3 to 4 weeks to exert clinical or to exert significant therapeutic effects. So 3 to 4 weeks time it will take for the drugs to actually exert their good effect or therapeutic effect. So in this case, patient compliance is very important. Also remember that the drugs, the various group of drugs, they have their own side effect profiles. So the available antidepressants, they do not differ in overall efficacy or speed of response or long term effectiveness. The choice of antidepressant made by a clinician is mostly determined by the side effect profile of drugs, because each of this category of drugs like TCAs, SSRI, SNRIs, atypical antidepressants, and MAO inhibitors, they have their own side effect. So the choice of the drug is based or determined by the side effect profile of drugs. Okay. Now there is also psychotherapy, which includes cognitive behavioral therapy, interpersonal therapy. There is also ECTs, that is electroconvulsive therapy, transcranial magnetic stimulation, vagal nerve stimulation, and deep brain stimulation. So these are the therapies which are used in case of severe depression or major depressive episodes. And to use all these therapies and pharmacotherapy drugs, it the clinician, it's actually done by the clinician who is very qualified or highly qualified. And please do not prescribe or just say these drugs on the basis of just reading a few books or seeing a few videos on such disorders, because the drugs have their own list of side effects. So and it takes around 3 to 4 weeks for the drugs to actually give their or exert their therapeutic effects. So you have to remember that depression is the most common psychiatric disorder in India, and it's the most common cause of suicide. Also remember that the prevalence of this disorder is more in female as compared to male, and the mean age of onset is 40 years. Okay. Also, this is commonly seen in divorced and separated persons. And uh, this is also responsible for maximum DALY, disability adjusted life years. This has come in one of the MCQs, saying which of the disorder is responsible for maximum DALYs, disability adjusted life years, among all other psychiatric disorders. So the answer is depression. Okay. So please keep in mind the symptoms, the two prominent physical signs, the special features which are a little different from the very common symptoms which we see, and also the pharmacotherapy, as in the classification of different kinds of antidepressants. You can read about the side effects. They have a lot of side effects. You can read about that in pharmacology. And apart from that, the etiology, which has been documented in books and other research papers, and the different type of therapies which is being done by a psychiatrist or a clinician. So that's it, my guys. Please let me know if you don't understand anything, or if you want to know some more about it, or if you wish to read more about it. You can just comment and let me know, and I can give you the references. Thank you so much. Bye bye. Take care.